Before we begin, I would like to welcome you all to our informational webinar on workforce recruitment and retention for the state of Ohio. My name is Alfredo Serrato. I am the project manager for this collaborative training. Before we get started, I would like to share a bit about the Great Lakes Mental Health Technology Transfer Center. Our primary goal for the Great Lakes MHTTC is to support the mental health treatment workforce in our region. As part of our primary goal, there are three things I would like to share about the Mental Health Technology Transfer Center. We are based at the University of Wisconsin in Madison. We are one of 10 regional centers with 2 focus area centers. Apart from our regional centers throughout the country, we have a National American Indian Alaska Native MHTTC based out of the state of Iowa, and a National Hispanic and Latino MHTTC, which is based out of Puerto Rico. The entire network center is funded by SAMHSA, the Substance Abuse Mental Health Services Administration. And as you can see in our graphic, you will appreciate the expansiveness of the work done by all of our MHTTCs in the country. And on the lower right, you will see 2 beige boxes that represent the focus centers I mentioned earlier. It would also be good to note that our MHTTC Network Coordinating Office is based out of Stanford University in California, represented by the large orange box to your left. The informational webinar we will participate in today is for the state of Ohio, one of 6 states in our region. And I'm just going to give you a bit of the webinar format for today. This webinar will be recorded and available for viewing along with PowerPoint slides on the Great Lakes ATTC and MHTTC websites. Today's audio will be broadcasted through our computer speakers. Please make sure your speakers are turned on and up. There is no call-in number available. You may use the chat box feature throughout the webinar to ask questions or to add comments. A question session will be held after by Dr. Hoge after his presentation. Before we introduce you to our presenter today, you would also like to give you a warm welcome from all of our sponsors. The Great Lakes Addiction Technology Transfer Center, the Great Lakes Mental Health Technology Transfer Center, Ohio Mental Health and Addiction Services, our co-sponsor in Ohio, and the Annapolis Coalition on Behavioral Health Workforce. And now for the introduction of our presenter today. Our informational webinar today will be led by Dr. Michael Hoge, Professor of Psychiatry at the Yale School of Medicine and a Senior Science and Policy Advisor of the Annapolis Coalition. Dr. Hoge, a clinical psychologist, is a founding member of the Annapolis Coalition and a noted expert on workforce issues. His workforce expertise is drawn in part from 30 years of managing a broad array of publicly funded behavioral health services for adults and adolescents in the state of Connecticut. I will now hand you over to Dr. Hoge, our Learning Collaborative Leader. Dr. Hoge, thank you very much for your presentation today.
Good afternoon, everybody. Thank you, Alfredo. I'd like to say hello to all of my Ohio colleagues. I am a native of Ohio and completed my doctoral training in psychology at Kent State University, and much of what I learned about the field came from all of the internships and practica that I participated in around the state. I'd like to welcome you to this informational webinar on behalf of the Annapolis Coalition and thank our sponsors, the Great Lakes Addiction Technology Transfer Center and the Ohio Mental Health and Substance Abuse or Addiction Services Department for making this learning collaborative possible. The Annapolis Coalition grew out of a meeting in Annapolis, Maryland on September 10th and 11th of 2001 as about 60 people from the behavioral health field came together to address growing concerns about the lack of an adequate number of individuals in the behavioral health workforce and adequate preparation of those individuals. And we've been working as a group since that time to try to bring attention to these very serious workforce issues within our field and to find solutions to the many problems. This Learning Collaborative focuses on recruitment and retention in behavioral health. Recruitment has historically been a major issue in both the mental health and addictions sector. And it has probably never been a larger issue than it is in this point in time. With the economy of the United States being very strong, there are now an estimated 900,000 more positions of all types, not just behavioral health, but of all types in the United States that are open than there are unemployed individuals in the United States. So with the economy strong, it's a very difficult time to recruit individuals to any type of organization. This is also complicated by the Affordable Care Act, which has increased access to services and thereby the demand for a workforce to provide those services, and other issues such as the direction or press towards integrated care, which has led larger health systems, hospital systems, et cetera, to increase their hiring of behavioral health professionals, making it more difficult for some of the community-based organizations and smaller organizations to recruit. One of the things that we know is that not only is finding individuals to work in these organizations difficult, but keeping them in these organizations is a challenge. Someone once said that our basic approach to recruitment and retention is like the fishing practice of catch and release. We spend a lot of time finding people to employ and then inadvertently release them back into the pool of the workforce, losing them to our organizations. The rate at which individuals across all types of organizations, again, not just behavioral health, are quitting their jobs is the highest in this nation since it's been in 2001. So there's a lot of churning that's going on as people move jobs looking for better opportunities for advancement or compensation. And this too is complicating the challenge for behavioral health organizations of all types. This Learning Collaborative on Recruitment and Retention that we're launching, in brief, involves organizations that are selected, creating small change management teams. Those teams come together for a full day of training and consultation where they learn about recruitment and retention best practices. Each team starts to develop a plan around recruitment and retention during that day and then returns to its organization where over the next month they work with organization leaders and other staff to sort of finalize a plan and begin implementation. And along the way we provide technical assistance to the organizations as those plans come together and as they begin to implement those plans. The change management teams are to be comprised of 3 individuals, and optimally we like to see the Director of Human Resources, the Director of Services, and then one other individual be the folks that come together. So bridging human resources and service delivery sides, which are essential to sort of effective recruitment and retention plans. In your application, should you submit one, if you sort of depart from this structure, we ask you to explain the rationale if it's not really, this doesn't really fit with your organization. And we're open certainly to understanding what would work best in terms of these teams for your particular institution. In terms of the eligibility criteria for this project, nonprofits and for-profit organizations are welcome to apply. We ask that the organizations be in good standing with the various state agencies in Ohio and with the Federal Centers for Medicare and Medicaid Services. We welcome all sizes and types of organizations, large and small, and from all areas across the state of Ohio. We exclude multi-agency consortiums. This is an initiative that focuses on a single organization. It can certainly be from an organization that has multiple locations. There's no issue or concern about that. We do ask in the application if the organization is involved in other major change initiatives, and whether those would significantly compete for the organization's time and make it difficult to focus on this particular project. In terms of selection criteria, we're looking for applications that are complete, organizations that meet the eligibility criteria. We're interested to understand if the proposed team members seem appropriate for this project. We're very interested in the composition of those teams, and so in your application process, we ask you to take this particular issue seriously as you select the proposed members, to make sure that they truly would be available to participate and are available on the dates that have been established for the various for the in-person meeting and the various teleconferences that have been scheduled. We're looking to understand whether the recruitment and retention needs that the organization applying has, whether those are the kinds of things that could potentially be helped by participation in the collaborative. And we're looking for a demonstration of commitment and capacity to actively participate, which comes in part from a letter of support from the CEO or director of the organization. There is no cost or fee for actual participation. This is sponsored with federal funds through the Great Lakes Mental Health Technology Transfer Center. Participating organizations would have to cover travel costs for the three-member team to attend a one-day meeting in the Columbus, Ohio area. So let me say just a little bit more about the Learning Collaborative process. Those organizations that apply and are selected will receive notification and then be asked to participate in an orientation teleconference, which will provide a little instruction about preparation for the one-day meeting. We ask that the three members of the change management team, as well as the senior leader within the organization, participate in that orientation teleconference call. The Learning Collaborative meeting, as I mentioned, is a one-day meeting. We'll run from 8:30 in the morning until 4:30 in the afternoon, and that is scheduled for May 16th. After that full-day meeting, again, the change management teams will be working on development of their plans and then shift towards implementation. And there'll be ongoing technical assistance along the way. I will be conducting individual teleconferences with the organizations that are participating as they work to finalize their plan. And we also will provide feedback on the draft plans once those are submitted. There is a requirement to submit brief bi-monthly reports, and these probably will take no longer than an hour each to prepare. And then there are 3 Learning Collaborative conference calls after the in-person meeting, where we will ask organizations to report out on the interventions that they're employing, on their progress, on any obstacles they've encountered, and we'll be talking together as the collaborative goes on about the strategies for sustainability in terms of taking the things that you have begun and making sure that they live beyond the life of this particular collaborative. In terms of the content of the collaborative, during the one-day meeting, we will be reviewing with your teams the sort of major recruitment and retention challenges that exist and some of the goals that organizations might have. We'll do a comprehensive review of the best practices and evidence-based practices that exist in recruitment and retention. Many of these are drawn from behavioral health. Others are drawn from the larger world of human resource management, which has much to offer us. We've identified 32 specific recruitment and retention practices that we will be discussing over the course of the collaborative. We'll talk a little bit about measurement of recruitment and retention, although focus more specifically about that issue once you select your specific goals. We have a template, very simple template for building a recruitment and retention plan that you'll begin to work with during the collaborative day, that full-time meeting, and we'll use to sort of finalize your plans and update your plans as you go forward. We'll talk a little bit about the strategies for managing the change process. The three-person teams will have to go back to their organizations and interface with their own leadership around getting buy-in and support for the proposed interventions. And again, we'll talk about the issues of sustaining the work that you've begun. I think I've talked about technical assistance and review of plans. The other thing that I would just like to mention is the value of the peer learning in this process. In general, the coalition talks about these kinds of events as consultations and conversations. And the consultations involve the ideas that the coalition, through its consultants, brings to the participants. The conversation has to do with the ideas that the participants bring to the table, the best practices, for example, that they have been using in their organization. And this is a very powerful and sort of positive part of the experience as organizations share that type of information with each other and also build connections with other organizations so that those conversations can continue beyond the life of the formal collaborative. It's important to think about the framework that we use for workforce development, which applies here to recruitment and retention as well. And that is that there are no simple fixes to these very complex problems, that if you want to improve workforce issues in your organization, we strongly encourage a sort of engagement in something that we call continuous workforce improvement, similar to the notion of continuous quality improvement. We don't solve quality problems in a short-term way and then sort of move away from that focus on quality. We begin to engage in looking at workforce challenges and workforce solutions and then pursue those over time, evaluating our successes in addressing them, refining our strategies, and then going on to the next phase of continuing to address ways in which to improve the workforce in your organization. In terms of the time horizon for changes that you might accomplish, depends heavily on the kinds of objectives that you set. We just launched the first collaborative nationally on recruitment and retention a week ago, and to give you one example, some organizations are focused on the fact that they are struggling to get a sufficient number of applications, and so there are short-term ways to target objectives like that and to measure sort of the progress. There are other objectives, such as successfully hiring more people into positions, that takes a longer period of time. So we see sort of 2019 and 2020 as a possible horizon for looking for changes that occur as a result of your participation in this particular collaborative. In terms of the commitment that we're looking for, the senior leader of the organization would make the ultimate commitment and have ultimate responsibility for the organization's involvement, would appoint the team leaders. We'd like that person to participate in the orientation call and the very final call of the collaborative. It would be their responsibility to review and approve the recruitment and retention plan and to provide support to both the team and the plan to increase the probability of success. And we'll ask them to complete a satisfaction survey at the end of this process. In terms of the teams, some of these responsibilities are very similar to the leader. Participation in orientation call. It would be just the three-person team that would attend the one-day in-person meeting. They would hold responsibility for the development of the plan, seeking its approval and its implementation. Eventually looking at the issue of developing a sustainability plan, submitting the brief monthly reports, bi-monthly reports to us, and participating in 3 teleconferences. These are in July, September, and November, and will run 90 minutes each. And then lastly, completing a satisfaction survey at the end of this process as well. I assume that since you have heard about this particular event that you have accessed the request for application. It is available online and contains a lot of detail about this collaborative as well as the application process. The application is fairly simple to complete. There are 4 very short yes-no eligibility questions. The longest part of the application involves 4 narrative responses. We ask for a brief overview of your organization, a statement of your recruitment and retention challenges, identifying the kinds of things that you've tried to address those challenges, and identifying 2 obstacles to your participation in this collaborative and how you might overcome those. We ask for simply a substantive paragraph on each of these questions, so again, it's not a lengthy reply. We ask you to identify the proposed team, your 3-member team, and to submit a letter of support and commitment from your Chief Executive Officer or Executive Director. There is a short turnaround time for the applications. We ask that they be submitted by noon on April 5th, which would be the end of next week. In terms of practical submission, we'd like you to, the latter half of the RFA is the actual application, so you can discard the first several pages, which are just the information about the collaborative. Use the last half of the document as your application. We prefer that you scan that application with the letter from your CEO or ED into one document and submit it to us electronically. You will receive a confirmation within, I believe it's 48 hours. It's specified, the time frame is specified in the RFA. If you do not receive a confirmation, you should reach out to us to verify that the application has been received. It is that email confirmation that is sort of your guarantee that your application has been received and is being considered. So the Annapolis Coalition some years ago stumbled across this quote from E.B. White. He's the famous author who wrote Charlotte's Web, as well as a lot of other works for adults. But he is known to have written this statement, which is, "I get up every day determined to both change the world and to have one hell of a good time. Sometimes this makes planning my day difficult." And for us at the Coalition, the relevance of this is that we are very committed to making a difference in the world, try and improve things such as recruitment and retention of the behavioral health workforce. But we also enjoy having a good time, and part of the reward comes from working with like-minded individuals around the country around these important challenges in our field. So as you work through this process, and particularly during our day-long time together, we will do some very serious work, but we also strive to have a good time together in that process, learn more about each other, and enjoy that collaboration. As we completed the launch of the first collaborative of this nature in the state of Maryland last week, the evaluations by the participants were very high about that experience. As individuals reflected on it, they commented about the following kinds of things that they really appreciated. One is, some people said that they did not feel as alone in these problems or as hopeless about them after this event, realizing that many others are struggling with them, and also realizing that there are some major national trends, such as the strength of the economy, that makes it difficult to be as successful as we'd sometimes like to be. Another thing is, separate from whatever you get from the consultation that we have to offer, just participating in this event creates a process that will bring your attention as an organization back to thinking about how you can improve recruitment and retention, and that has value in and of itself. Beyond that, we have the wealth of best practice information to share about recruitment and retention strategies and the individualized technical assistance that we hope that you will find of value. So I believe that concludes the sort of more formal part of the presentation. And what we'd like to do now is see if there are any questions that we can address at this point in time. And again, if you want to ask those questions, you would do so by typing your question into the chat box. And I'm going to kind of throw this back to Alfredo to moderate the asking of those questions. Alfredo?
Thank you, Michael. We do have a couple of questions already. One of the questions is, will we earn CEs for participating in this collaborative? I guess I'll take that first question. I'm in touch with the Ohio Mental Health and Addiction Services Agency, and I'm working with them on getting an answer to this. The answer will be forthcoming. Because this is a different type of collaborative, we need to run through all this with the powers that be, and once we have an answer, we will go ahead and communicate that to everyone. The second question we have is, what is the time commitment for participating in this collaborative? I'll give that one to you, Michael.
Yes, so this is a complicated question to which I can only give a partial answer. So we anticipate that the change management team's preparation before coming to the one-day event would be sort of probably in the range of 3 to 4 hours. We'll simply be asking you to gather a little bit of information about recruitment and retention issues in your organization before you attend the one-day collaborative launch. There'll obviously be sort of the day-long meeting in Columbus, so it will be that day plus any time you would need for travel. There are the 3 learning collaborative calls, which are 90 minutes each, and the submission of brief reports. I think there'll be 3 or 4 of those, which would comprise probably about 4 hours total of your time for all of those reports, not for each of those reports. The piece that's much harder to sort of gauge is the time involved in developing and implementing the recruitment and retention plans. Depends a lot on the types of objectives that you select, the agreement within your organization about what to focus on. So it is difficult for us to sort of judge that. Would like to emphasize that that work, however, is really work on behalf of your organization. These are not sort of tasks or responsibilities that are sort of administrative that come just from participating in this process. So they are efforts by your team to decide what's important to your organization and to set about implementing those strategies.
Okay, thank you, Michael. We do have one more question. Will the collaborative include reading materials or resources on workforce trends? What resources will you refer us to?
So during the day-long meeting of the collaborative during the launch, as we're reviewing various best practices, we will be highlighting resources that are available that are related to the best practices. There is a national sort of toolkit on recruitment and retention, which we'll briefly discuss and identify for you. There are national reports that have been done by various organizations. The ATTCs have done a lot of national studies of workforce recruitment and retention that are relevant both to addictions and mental health, and identify the types of practices that clinical managers are engaged in around the nation to improve their workforce, specifically with respect to recruitment and retention. Beyond that, there are numbers of other websites and reports that we will highlight for you. There are no assigned readings, and we are not, I will review for you sort of what is known about recruitment and retention problems and some of the data, but there will be no assignment or focus on you reading research reports about the nature of those problems. The resources that are provided, many of which are summarized on a resource list that we will distribute at the meeting, are very focused on things that might be valuable to you in terms of your implementation, your design or implementation of a plan for your agency. The national data is useful sort of as a background and a little bit as a benchmark, but overall the approach is to figuring out where your organization is in terms of its recruitment and retention success and trying to move the needle in a positive direction. So you're really benchmarking against your own current outcomes in the context of this collaborative process.
Thank you, Michael. The next question is, I am interested in becoming a part of this process, but I am unavailable for the day of the conference. Would my absence interfere with our participation? So I think that really depends on
kind of the role of the person sort of speaking. If you are central to, let's see, how can I say this? So we are not expecting, in most cases, that the most senior leader in the organization would come to the Learning Collaborative Day, that they would instead sort of assign a team to lead this project. If you believe that if the person speaking would really be central to this project, then I think that's a more complicated issue if it could really compromise your participation or the participation of your organization. If you are uncertain about that issue, I think there's two things you could do. You could send a longer email after this to Alfredo, whose email address is up on the screen right now, and sort of lay out the situation a little more clearly, and we could sort of advise you once we have that information. The other is you could submit your application and put that information in, and it would be considered at that time.
Right. Thank you. The next question is, how many organizations will be selected?
Up to 10 organizations will be selected to participate in this process. With 3 people per team participating, it means that we'll have about 30 members of the participating organizations in attendance on that first day. Alfredo and I will be there. I think another 1 or 2 people from Great Lakes, ATTC, and then a few people probably from the Ohio Mental Health and Addiction Services Department.
And one of the last questions we have here is, what is the main thing that my team will take away from participating in this collaborative?
So I think that you'll have a better sense of sort of what's happening nationally with recruitment and retention in terms of the nature and severity of the problems. I think you'll have a much increased sort of understanding of the breadth of recruitment and retention strategies. Some of these will not be surprising to you, but I think the comprehensive sort of review will be possible, will really sort of increase, for most participants, their sense of or understanding of the knowledge base. I think you may come away with a much better understanding of how retention is an essential recruitment strategy. We see the process as circular. You bring people into the organization, but the efforts at retention improve the quality of the organization and your workforce, and in turn make it much easier for you to attract additional individuals into the organization. I think you'll have a beginning understanding of kind of where your team is about the things they want to focus on. So those would be the things that I would highlight as some of the main takeaways from that first meeting.
I can add to that too. Yeah, and this is Todd Molfenter, the director of the Great Lakes ATTC and MHTTC, and I think something else I think is really a unique opportunity here, and is that just Michael's and the Annapolis Coalition's expertise. I mean, we, 2 or 3 years ago, we really wanted to focus on this issue, and because we just know how important it is to providers in our region, and really what we discovered 2 things. One, it's not an easy issue to address, but it is addressable, and that there's really only a few organizations around the country that have been able to help people with this, and of those, the Annapolis Coalition by far has the deepest understanding and what I call bench strength in the behavioral health area. So I would dare say I think sort of the expertise and opportunity here is around this issue in this field is probably or I wouldn't even say probably, it is the best you can get access to. So, Michael, thank you for agreeing to help us out with this, and I think for those who really want to make a difference here, this is a good opportunity, and I also will say, the things that we and Michael are asking for in the application and just sort of outlining is part of their evidence-based practice for creating success in this area. And so I think Michael's, I think, has been sensitive that, you only have so much time to dedicate, but also he's also realistic of these are the types of things that really will lead to success. And so I think for those interested in this issue, I don't, at least in the short term, I don't think you'll run into a better opportunity.
Thank you, Todd. Well, I think it's a good time to conclude the informational webinar. I would like to just share with everyone that there is an opportunity for the next week or so to ask as many questions as you like. My phone number and email are there. Feel free to give me a call or to email me any question, and I'll be more than happy to address it. I would also like to emphasize that two types of agencies can actually participate in this. If you're in the mental health arena, you're welcome to participate. And if you're also in the addiction arena, that is also another agency that we're welcoming to participate in this, because we know that the problem is across the board. So I would welcome you all to send me questions. I thank you very much for your participation today, and I hope to get to talk to you in person sometime soon. Thank you so much. Have a great day.